I'm Dr. Amir Badrikelo, Medical Eye Care Advisor for Light for the World and co-chair for IAPB Eastern Africa. I have with me Mr. Bahaa Sabry, who is Director of Programs and Sustainability at Al Noor Maghrabi Foundation in Cairo, Egypt. He has been nominated as the Eye Health Hero by the International Eye Foundation at the IAPB 9th General Assembly. Mr. Bahaa Sabry, it's a pleasure to have you here, and congratulations for having been nominated Eye Health Hero at the IAPB 9th General Assembly.
Thank you.
Would you please tell us about your work, what you do?
In fact, I am part of a teamwork. Their main concern is competing blindness in Egypt. And our foundation is founded by Dr. Akif al-Maghrabi in 1992. We start delivering a patient or surface delivery in 1999, and by this date I start working in outreach program. We establish and create a new program in Egypt, never been there. The outreach program and caravans to help people out of reach, really, in our country, in a different districts, different governorates, unreachable. They have a lack of services, a lack of resources, and I take the challenge in all this situation, like lack of doctors and lack of money, lack of areas, lack of bad transportation, all this challenge. I take it for me as a opportunities and try to solve and face the problems.
So we know Egypt is one of the most populous countries in sub-Saharan Africa, and how do you organize your outreach activities?
In fact, when we start this unique services in the beginning, the patient, of course, was worried and suspicious. Why you are giving us a free services? We try to start facing this problem in the beginning by explaining this is their right. They have a right to get and services and to be served, to have a good vision and sight. So by the time I start working with the governors in each governorate and explain to him, I'm going to the unreachable areas to help you and to help the Ministry of Health, giving hand in this area of the ophthalmology area.
So at outreach sites, what kind of services are you giving?
We examine a patient. Until now, we do more than 1,000 outreach caravan. Also, we we examine more than 300,000 patients. We giving a free cataract surgeries, more than 17,000.
This is over how many years?
Since we started, it's almost 12 years right now.
12 years now.
Yeah. We start our outreach program by one in a week, and then we increase it to be 3 caravans per week.
So if you are providing, free eye care services in underserved areas, how are you ensuring sustainability of your service delivery?
Sustainability is a big issue. You have to face it in a different solutions. One of them is a multi-tiers pricing for the same services.
Okay.
If you have a cataract, for example, you have a different categories and different prices, and try to, in the beginning, we don't know how to be sustainable. What's our revenue against the expenses? So in the first year, we start without background, and then after almost 4 years, we start giving 60% of our patient in a multi-tiers pricing paid, and 40% of them free, completely free.
Yeah. So you are basically subsidizing the free patients from
Yes.
the income you generate
Yeah.
from the other segments.
Yeah.
It's the 60%.
We have a
segment.
low-pay hospital.
Yeah.
This hospital serve the walk-in patient in a multi-tiers price, and even sometimes if a walk-in patient asks for a free service, we have a counselor to discuss his economic situation, and we give him a free even services if he is not even an outreach patient.
Yeah, I mean, you are providing a huge number of services from your statistics, basically. And what do you see as the major challenge or major challenges in achieving Vision 1020 in your country?
Yeah, the main challenge is to reach all districts, all areas, unreachable areas. There are a burden in patient to move from his village to a hospital in the cities. So this burden, this is the main challenge. A lack of services in the most of villages, and the economic situation for the patient is limited, and also our resources is limited.
Yeah.
So, but we are trying to help people and help the neglected patient and people in the area.
You have been attending the IAPB 9 General Assembly for a couple of days now.
Yeah.
So what's your experience from these meetings, and what is your take-home message?
I believe this meeting is very important for the prevention of blindness people, and organization and foundations to meet, to exchange the knowledge, to exchange the experience, to understand the other people's situation and have a good experience from their solutions and experience.
Yeah. Sabah, I would like to thank you for sharing your opinion and your experience from Egypt, and I would like to congratulate you again for having been nominated iHealth Hero at the IAPB 9 General Assembly. Thank you very much indeed. Thank you.
Wow.